Hi, this is Kim Testa, and the issue I chose to discuss was regarding access. So, access to healthcare involves many different aspects, which include limited healthcare providers, lack of services, means of accessing, cultural barriers, and financial limits. For this discussion, I'm going to focus on the financial aspect with regard to insurance coverage and the lack thereof. Over the past years, insurance coverage has been a huge issue in the political arena, as this possesses a major problem for many U.S. citizens. Rising healthcare costs, increasing insurance costs, and premiums are wreaking havoc on the health of our population. The rising costs are not met with increasing incomes, making more difficult for people to afford even limited coverage. The United States has suffered a significant decline when it comes to accessing health insurance coverage. As the Commonwealth Fund of 2011 shares, as of 2010, more than 81 million working age adult, which is 44% of those ages 19 to 64, were uninsured or underinsured, which is significantly increased from 61 million or 35% in 2003. These numbers alone represent a bleak outcome. The total health care spending in the United States is on a continuous rise with no end in sight. Healthcare spending in 1960 was 5% of the gross domestic product and today is about 19%. But it is projected to reach 34% by the year 2040. Another staggering fact is the number of preventable deaths. According to the Commonwealth Fund 2011, the U.S. ranks last out of 16 industrialized countries on a measure of mortality amendable to medical care, meaning deaths that might have been prevented with timely and effective care, with premature death rates that are 68% higher than in the best performing countries. The Affordable Care Act was introduced into law by President Barack Obama to help combat the issues related to health insurance and access. As our text explains, the ACA's goal was to improve accessibility and quality for more Americans by making health insurance more affordable. It was projected to provide 25 million Americans with affordable health insurance. The Department of Health and Human Services explains that the ACA has covered issues such as pre-existing conditions to now be covered, and keeping unmarried children up to age 26 on their parents' insurance coverage. A key component of the U.S. Affordable Care Act, as explained in a 2019 article by Kobayashi, Altendag, Truskavansky, and Berkman, was the expansion of Medicaid eligibility to non-elderly adults with incomes up to 138% of the federal poverty level. This policy resulted in 9.6 million people becoming newly eligible for Medicaid. The article by Himmelstein et al. States that even despite gains in coverage and access to care from the ACA, it did not change the proportion of bankruptcies with medical causes and medical costs continuing to outpace incomes. 29 million remain uninsured, and even with health insurance coverage, they are faced with unaffordable out-of-pocket costs as co-payments and deductibles add up. Benchmarking is used to measure these qualities to evaluate the outcomes through comparison for the ACA as compared to prior to its implementation. These qualities involving access are also compared to other highly industrialized countries. Health policy can be used to improve this problem by utilization of committees and policymakers, bringing the issues associated with this continued problem to the forefront to help implement change both locally and nationally. Policies to include the implementation of things like telehealth in more rural communities. Also, insurance companies recognizing nurse practitioners as medical providers in standalone facilities. These efforts would help reduce the cost of coverage and help the population to gain access to healthcare, which in turn will help to decrease quality measures, such as mortality due to the inability to access healthcare. These are simple steps that can help to improve access, to ultimately improve the overall health of the United States. Although this has been an issue afflicting the U.S. for years, the recent implementations have made some strides. But as I have presented here, there are still many that remain. Maybe we need to look at some of the industrialized countries that are surpassing the U.S. tremendously in this effort and take a page from their book to help resolve this issue. The following are the references that I utilized for this presentation. Thank you.